Welcome, everyone, back to Wellness Wednesdays. And I'm your host, Carla Coleman. I'm the Director of Communications for New Salem Baptist Church. And I'm happy to be here today to talk about a topic that really has hit hard our community, the Black community, in a way that, for decades now, myself, and, in my generation before myself, has been dealing with, and that's diabetes. I was just telling our guests today, and I will introduce them shortly, that both my mother and my father passed from complications of diabetes. It is something that runs in my family. I have struggled with the disease for now over a decade, and and I have many friends and uncles and aunts and cousins that all do the same. So managing it on a daily basis is a challenge. It is hard. And the biggest thing is that too often I don't like to talk about it. And that's a problem because we need to talk about what we're dealing with daily so that we can learn more about how to manage it. So I want to introduce two presenters today. One is Daria Abram, and the other is Tara Walker. And they're here because this is something they do all the time. They talk about diabetes and how to manage it and what we need to know to live a quality life with the disease. So, ladies, thank you. I'm so happy to have you with us tonight. Let's start out with just quick introductions. Tell us a little bit about yourselves. Daria, you want to start first?
Sure. Hello, everybody. My name is Maria. I am a registered nurse down at Grant Hospital. I've worked in the medical field for almost 20 years now. I've done pediatrics for a long time, which is where we've seen a lot of type 1 diabetes, which we'll talk about in a little bit. And then I worked in geriatrics, which then I saw the opposite a lot of time too. Um, Currently, I'm working in the OR, which has been really nice. It's a huge change. I love it, and it's been great. So that's me in a nutshell.
Excellent, excellent. And so, Tara, tell us a little bit about yourself.
Hi, yes, my name is Tara Walker. I'm a registered nurse and I have been for 26 years now. Yes, I started when I was 13. I started out as a school nurse, and then I transitioned over to working in psychiatric nursing, behavioral health. But believe me, we see diabetes. It's rampant, particularly in the population that I work with. And so, as Daria was saying, I am very excited to talk about this topic today. So, thank you for having me.
Oh, very glad to have you. We have two experts in the house today, many, many years of experience. So I'm excited about that. Why don't we? They also have a presentation to share. So as you know, on this show, we start with the presentation so we can get some good education and good information, and then from there we'll start asking them all the questions that may be in our minds. So think of your questions. You can even start putting some of those into the chat, and let's get started. So why don't we bring up the first slide? And Daria, I think you said you were going to lead off here.
I did. So you can go ahead and go to the first slide, Mike. All right. So I always like to talk about what diabetes is. A lot of people don't know. We talk about it, we say the word all the time, but a lot of people don't know what it actually is and what it's doing to your body. So, what is diabetes? It's basically a disorder of your pancreas. Your, the pancreas is a small organ that sits next to your stomach in your abdomen, um, and it produces um, a hormone called insulin. You need insulin in order to break down sugar and put it into the cells in your body so that your body can use that as energy. Well, when people have diabetes, they either don't have that insulin, or the insulin is not working properly enough to pull the sugar from the blood to put it into the cells. So insulin is a hormone that is produced by the pancreas, and it basically just helps pull the sugar out of the things that we eat. When we eat, the sugar goes into our bloodstream, pulls the sugar out of our bloodstream, puts it into our cells so our body can function, so we can have energy to function and get through the day. What happens to the sugar or the glucose? Glucose is just a fancy word for sugar, so I try to keep it basic and just say sugar so everybody knows. What happens to the sugar in people with diabetes? When people have diabetes, the insulin is either not being produced or is not working correctly, which then causes a buildup of sugar in your bloodstream, and then your body can't use it. When the sugar builds up in your bloodstream and there's too much, it becomes very acidic. And this is where problems come in, because now you go into what's called ketoacidosis, and it's just too much acid in your blood, and it starts messing with all of your organs. And then you're going to have a bunch of other issues, which we'll talk about here shortly. The cause of diabetes is still not known. They're constantly doing research and trying to figure those things out. However, there are several common factors that people with diabetes, and specifically type 2 diabetes, have in common. So obesity, having a sedentary lifestyle, high blood pressure, high stress levels, having any type of pancreatic disease, a high intake of unhealthy foods, and then also genetic disposition. So you may have it because your mother had it. So, these are all just risk factors. They're not necessarily the cause of diabetes. And the reason why they say that is because, well, there's a lot of people that have obesity or have a sedentary lifestyle that don't necessarily have diabetes. But these are the typical things that we see surrounded around people with diabetes. All right, you can go to the next slide.
So, what we have here are what we describe as the types of diabetes. You may be familiar with, or you may not be familiar with, and the symptoms that usually will occur. Um, Formerly was known as the juvenile diabetes with a type 1, and they would call it the juvenile diabetes because it would be diagnosed by the childhood age. That's usually where the individual is not able to produce any type of insulin in their body whatsoever. So also they would name those type of diabetics non-insulin dependent, or insulin dependent, I'm sorry, meaning that they would strictly have to go on to insulin because their body will not produce it. The most common type of diabetes, which is type 2 diabetes, is where the insulin is produced in the body, but the body is not able to use that glucose. It just goes on to stay in the bloodstream, and it can cause other issues and other problems. And this usually is the most common type of diabetes, particularly in African Americans, is the type 2 diabetes. As Daria was saying, usually risk factors of obesity, sedentary lifestyle, genetic factors, heredity. Um, and then the third type that I have listed here is gestational diabetes. Usually, this is a diabetes that can be diagnosed during pregnancy. Women that go in and when they have to do an oral glucose test, you may have heard, um, and then their numbers are at a certain level, and then they get diagnosed with gestational diabetes. If those risk factors, as was mentioned earlier, are usually in control, it doesn't usually go on to develop full-blown diabetes, but there still is that risk. And then the fourth type that I have listed here is the pre-diabetes, which again, precursor, if left untreated, if those risk factors aren't maintained or under control, can lead to diabetes. Some of the symptoms that we identified during our research of diabetes was increased hunger, increased thirst, frequent urination, sometimes unexplained weight loss. And you think, well, if I'm having increased hunger, I'm going to have increased weight. But what happens is within the body is that the glucose that is not being utilized is being burned up, the fuel, and that can cause some unexplained weight loss. Slow healing wounds is also another symptom, which is why it's important, particularly with diabetics, that you maintain your feet properly, you get good foot care, because a lot of times, because you have a loss of feeling sometimes in your lower extremities, in your feet, that it's important that you take really good care of that. And sometimes wounds don't always heal as fast. Frequent infections can occur, blurred vision, fatigue, irritability, neuropathy, which is that loss of sensation or feeling, sometimes in the hands and the feet, that tingling feeling. And then are also some other symptoms that you may have if you were affected, or a loved one, someone you may have known that was affected, that we may not have listed here, but these are just some of the common symptoms that we identified. You can go on to the next.
Okay, so the way people are diagnosed with diabetes is whenever you go to your doctor and they draw your blood and they want to check your levels, one of the things they look for is your sugar. And they'll just do like a regular glucose test just with your normal, the CBC and your CMP, all those things. I know all these initials don't really mean anything to a lot of people, but they normally just check for that. And if your sugar is above 99, so normal sugar is between 70 and 99. So once it hits 100, they're going to want to do another test that checks your hemoglobin A1c. Your A1c is a test that checks an average of what your sugar has been running over the past 2 to 3 months. So they will have you do a A1c. You don't need to be fasting for this because again, it's over the course of 2 to 3 months. And if they find that your A1c is higher than 6.5% in two separate occasions, so they'll usually check you 1 month and then 6 months later, usually. And if it's that high, because normal A1C should be less than 5.7%. So once it's between 5.7 and 6.4, you're in that pre-diabetic stage. And you want to start doing the things to make sure that you don't have diabetes. A lot of times doctors will start you on a medication, which we'll talk about that soon too. But they'll start you on a medication to keep you from having full diabetes. But if your A1C is higher than 6.5, then they will diagnose you with diabetes. Also, if you're fasting glucose, so you come in and you haven't had anything to eat for 8 hours or more, and they check your sugar and it's above 126 on two separate occasions, the same thing. They will diagnose you with diabetes. And um, along with that, they will check your urine for what's called ketones. Ketones is an abnormal breakdown of fat. So when your body normally has sugar in the cells, that's what it uses as the energy to burn up so we can live. When you have diabetes and the sugar can't get into your cells, your body will start breaking down the normal fat that's in your body, and it will come out in your urine as ketones. Ketones in your urine is really bad. You don't want to have a huge buildup of ketones in your body. When your body is basically eating itself. And when it's doing that, that's when you get into that part of that ketoacidosis that I talked about earlier, where your bloodstream, everything gets really acidic and it starts attacking all of your organs. And that can then lead to coma, and then eventually people can die from that. All right, next slide.
So the prevalence, what we noticed here during our research is 1 out of 3 adults are pre-diabetic. That's pretty significant. Um, 34 million people are diabetic just here in the United States, and worldwide, I was looking at some statistics that were even greater from the CDC. So you think about the fact that yourself and 2 other people, maybe in your family, and sometimes you can be pre-diabetic and not even know it, particularly if you haven't followed up with your healthcare providers or had your physical assessment or had your blood sugar checked. Um, you can be pre-diabetic and not know it. As Daria was mentioning, the way that they'll check that is by getting a drawing your blood, um, and they'll find out based on if you fasted or non-fasting what your numbers will look like. Once you're diagnosed from the testing, they use a glucometer. So you'll see like a little miniature machine that can be purchased from like your local pharmacy, and along that with the testing strips and the alcohol wipes, you take this equipment home, and then you monitor how often you, usually before a meal, just so you know what your fasting blood sugar is. This is once you get a diagnosis of the diabetes. The next slide.
Okay.
The
So,
progression of diabetes. Go ahead, Derek.
sorry. So, I'll all right. So the progression of diabetes on the body. Um, so again, when you have this huge buildup of sugar in your bloodstream, your kidneys have to be able to filter all that. Um, Along with the fact that most people that have diabetes also have the precursor of high blood pressure, which then leads to kidney disease. Along with heart disease, people have a lot of trouble with heart attacks and strokes. And then the blurred vision. So when the sugar is in your bloodstream, it's going to all of your organs and it affects everything um, to an extent. Blurred vision and blindness, we typically see that after people have had it for a long time, but lately it's been getting like I've been seeing a lot of people younger, like in their 50s and 40s, that are having a lot of blurred vision, or having a lot of trouble with their vision because of their diabetes or is not controlled. Then it goes into that ketoacidosis, um, which we talked about earlier, can lead to coma and death. What I've been seeing lately working in the OR is a lot of amputation of limbs, and that's because of the neuropathy. So when your feet are numb, you don't know if when you stubbed your toe last week, if you got a cut there because you can't feel it. And a lot of people aren't really looking at their feet like they should, which, like Tara mentioned, is important to have really good foot care, because you can't feel your feet, so you don't feel the pain of that. I have this cut here. And now, because of the sugar that's in my blood system, this cut is not healing like it should. And now it's infected and it's taken over 4 of my toes. And so now I need to go do something about that. So we've seen a lot of people come in with these huge ulcers on their feet, on their lower legs, and now it moved. Um, and then, of course, if your diabetes is not controlled over a longer period of time, or even a short period of time, and you get a huge spike in your sugars, that could lead to death. Next slide.
So some of the providers, specialists if you are current with your healthcare needs that we listed here, is like your primary care physician or your providers. So if you're being followed by your medical doctor or your certified nurse practitioner, a physician's assistant, or a certified nurse specialist, they specialize in your healthcare needs. They're able to test you and to monitor if you are at risk or if you are full blown and you've been diagnosed with diabetes. Also, your family doctor who treats and diagnoses the health care needs of yourself and also your family. So, as Daria was mentioning, that younger people now are being, we're finding more numbers, more cases of them being diagnosed younger for diabetes or at risk. Obesity, lifestyle, being sedentary, lack of exercise, diet, the things that they're consuming. And we're seeing diseases that we didn't see till probably in older generations. We're seeing them now in younger people. And then the endocrinologist is a doctor specializes in the treatment of disorders of like diabetes, thyroid. They can also provide you with the necessary information that you need regarding your diabetes and follow up and treatment. The next slide.
All right, treatments. So, of course, there's always insulin. If you don't have enough insulin, the thought is give you some to help counteract what's happening with your pancreas. And there are several different types. There's rapid acting, so you get it and it works right now. Same thing with the short acting. Intermediate, then there's a mix of like a short and an intermediate, and then long acting. Um, so, and the long acting is usually, you take it once a day. So it lasts the whole day. As well as the medication. So metformin is that one that they will typically give you when you're in that pre-diabetic stage. That medicine, um, and I don't know why I always smile with this one, but this I feel like will either teach you what to do or you're just not going to learn. So, one of the side effects of metformin, it does cause a lot of abdominal and gastrointestinal upset. So, the purpose of it is to get all that sugar out of your blood stream, and then you get rid of it through your gastrointestinal system. Well, if people are still eating a lot of carbs and a lot of sugars, then you're going to have a problem when you're taking this medication. So I always try to warn everybody, like, I know you're taking this medicine to help, but you really have to be on it about your diet, because if you're still eating the same way and taking this medication, you're going to know real fast that something is going to have to go. And then there are, I mean, a countless number of other medications out there to help aid in with diabetes as well. Um, the most crucial part for type 2 diabetics is exercise and weight management, and then carb counts and diet control. If if you are able to change your lifestyle, that is what makes the biggest difference on how you manage your diabetes. The medicines are great, the insulin is great, but if you can naturally do it just by what you're eating and what you're doing, that is the best way to manage your diabetes. Next slide, please.
Can I add, Daria, back on the previous slide, just real quickly? Um, some individuals who are on the insulin may have been prescribed by their doctor, their PCP, or the endocrinologist, maybe a insulin pump, and they also have insulin pens that they may have been prescribed to use. Those are additional types of treatments and interventions that are used. And as Daria was mentioning, the medication is great, but you still, it's very important to make sure that you're using the diet control, weight management, and exercise. And I say all this, and I'm thinking to myself, I recently was at my physician and I was told that I was pre-diabetic. And the biggest thing, that the hardest thing for me, is that I like soda, regular soda, not diet, regular. And so one of the hardest things for me is the not the switch over. I need to just stop, period. Sodas altogether, not diet. And so I was looking at this and thinking to myself, I would be a hypocrite to say, that I've been doing these things and knowing that I haven't been, but I certainly need to start to look at this and begin to do a lot of these things that are mentioning here so that I don't go on to develop the full blown diabetes. Next slide. So, in addition to that, with the diabetes and being diagnosed with that, pre-diabetes as well, you want to do carb counts and diet control. Why is it important to keep a track of that? It's simple. It helps to better manage your blood sugar throughout the day. The breakdown of glucose and the sugar in the body helps to regulate your what's called your glucose numbers. So you want to stay between that 70 to 99% range in order not to be go on to develop full blown diabetes. But those people who have the actual diagnosis, sometimes their numbers are going to look a little bit different. Their numbers, their doctors, their endocrinologists may want their blood sugars to stay like around 126. They may don't want their numbers to go too low, because then they can get in that hypoglycemic stage, because they're on insulin and other medications that they just have to be more conscious about. Your doctor will tell you how many carbs you should have in your diet. So when you're doing the carb counting and the type of foods that you need to stay away from, or the things that you need to add to your diet. So you want to look at the vegetables, the non-starchy, such as the broccoli, the green leafy, the carrots and tomatoes. And I know if you're like me, you're looking at some of this stuff like, yeah. um, Particularly if it's not something that you've already incorporated in your diet, and you're just starting to realize at this age now, for me, that is really important to have these things in your diet. Fruits, oranges, melons, berries, and apples. When we think of fruits, you think that because they are healthy, that you can have an unlimited amount, but they do have a really high carb count, sugar count. So you do need to be really careful in how much you're consuming. Your grains, your whole grains, for at least half of what you get for the day, is how you can control your diabetes. Proteins, your nuts, your beans, legumes, we say, your lean meats, your chicken, turkey, turkey breast, fish, and then your dairy, your non-fat, low-fat, cheese, and milk are additional types of carbs used to control your diet. Your next slide.
And just to go back to that next one, that last slide, real quick about the hypoglycemia. Um, so yes, it is really important that people listen to what their doctors and that the specialist, the endocrinologist, is telling them, because yes, although normal blood sugar is between 70 and 99, someone that has had diabetes for a long time, and their sugars are normally 300s, 400s, their doctor may not want their sugars to be lower than 120 or 140, because
Correct.
yes, they will get into that hypoglycemia. And when you're used to your sugars being so high for so long, when it comes down, you start feeling sick, and people don't want that. And then people become non-compliant with their plan, with their diet, because they don't want to feel that of having their sugars lower. So I just think it's really important that people really pay attention to what their doctor is telling them. There's a chart that that they will give you for the carb counting. So if you have like 10 carbs, and you have to read a lot of labels when you're buying food. So if there's 10 carbs in this one food, that's probably 1 or 2 points of your on your carb count. And so it'll tell you how many counts or how many carbs you can have throughout that day. So just be mindful of reading labels, making sure that you're following exactly what your doctor is telling you to get the best results. Okay, thank you. Sorry, next slide.
Well, before you go into the quiz portion here, I just want to say that a decade or so ago, when doctors diagnosed, and I'm not just saying for myself, but for my mother and my father and others, this is I'm really happy to hear that you're talking about the diet and that you're talking about carb counting, etc. Because they just told you to take this medicine and take it regularly and
Yeah.
go. And that was not the case. I mean, they said, yeah, watch your weight, try not to eat too much, sweets. And I'm going, wow, a lot has changed in just 10 years, even
Mhm.
5 years ago. So I'm excited to hear that both of you are talking about the importance of not just exercise, but what you're eating and how that impacts your your blood sugar levels throughout the day.
And I'm glad you brought that up too, about the sweets. So a lot of people have the misconception that, oh, well, I'm not eating any cookies or cake or pies and all that good stuff, so I'm
Right.
good. But I'm like, well, but you're probably eating like this pasta and all this bread and all because those
Right.
the carbs break down as sugar in your body. Even though it's not sweet, it's not considered a sweet, um, is still the way your body breaks it down ultimately is sugar. So that's something to be mindful of too. It's not just the cakes and cookies and all that. It's the carbs,
Correct.
pastas, and the bread, all those things too. So
Mhm. And the fact that
And
some foods can counteract it too.
yes. And as I'm
right.
thinking about this too, when I was mentioning about diet sodas, actually what you want to do is you want to avoid diet sodas or any type of artificial sweeteners,
Mhm.
because although they may label them as sugar free, um, aspartame or sucrose, some of the other ones, I'm sorry, I'm drawing a
Mhm.
mental blank here. Um, what those can do is it causes an increase in hunger, which can also basically lead to increasing carbohydrate intake, uh, which then can also lead to increased glucose, hypoglycemia. Yeah, so I was just thinking about that as you were always mentioning about the different types of the foods and drinks and diet control.
Absolutely. Sorry about the interruption, everyone. So, yeah, I'm just excited to hear that we're getting more of that information and hopefully directly from the doctor as opposed to, just from your own research or going out and having someone, maybe a nurse might, give you the information that you need. So excited to hear that. Do you want to go through the quiz real quick, and then we really need to get to questions because we have a lot of them in the
Sure.
chat. Mhm.
Sure.
You can go
So
ahead
we
to the
just
next
had a
slide.
few, yeah,
Sorry.
we just had a few questions we were going to ask. Go ahead, Daria, just to see what you remember, what you learned.
So the first question was name at least 2 types of diabetes. And if you all remember, we mentioned 4 of them. And then what are some common symptoms of diabetes? Um, and then can you think of one treatment or intervention for diabetes? And then true or false, which we didn't really mention this, but I'm curious to see what people think.
Yeah.
True or false, diabetes can be cured. So go ahead to the next slide.
And you can write these down for yourself, and then here they are. They have the answers for you.
So yeah, so we mentioned that the four types. There actually are many other types of diabetes. You may have heard, um, besides the one we started on the first slide, we talked about diabetes mellitus, which is the one related to the diet control. But there's also diabetes insipidus, which can occur when you have loss or frequent urination. And there's other types. But the four types I honed in on was type 1, type 2, gestational, and prediabetes. The symptoms we talked about, but one other symptom that it was sitting here going through my mind as I was thinking about it. If you ever hear a physician mention about having a fruity aroma or a sweet breath, that's also one of the common symptoms of diabetes.
Mm-hmm.
Number three, our answers we had listed was insulin medication, diet and weight management modifications. And then Daria's right. We didn't talk about number four, which diabetes can be controlled and managed, but there is no cure at this time for diabetes.
That was a really good point. I mean, but I have seen people go from, they're taking insulin, they're doing all these things, but then they come back, they go ahead and do the exercise, they're eating right, they're changing their lifestyle, they cut out all the soda and diet sodas, etc., and they're able to really, really control it. And that's the key, because I think some people don't feel that they can even control it,
Oh yeah, yes.
unfortunately. All right, so we need to get the questions in the chat. So one of the first questions was about pre-diabetes, and that is, we already explained. You explained quite well what it is and what does it mean. But he's like, what does it mean for me? Is it serious or life-threatening? And I'm going to say you probably say yes.
So yes, it is serious, because again, it is that precursor into diabetes. And so if you don't start taking control of it now, you're going to have diabetes, and diabetes is life threatening. So, yes, pre-diabetes is very serious, and you should try to do everything you possibly can to backtrack that number down.
The
Excellent.
seriousness of having the pre-diabetes is it works on a micro. As I was doing the research on this, it starts working on your like the small blood vessels, like in your kidneys and in your eyes and in your heart. It starts to weaken those type of vessels from it. So yes, it is very serious. It is very life threatening. Um, if it's not under control, if it's left untreated.
Excellent. The other question is, if you're on insulin, is it possible to come off of it?
I With type 1 diabetes area, you'll have to jump in and kind of help me with this one. Most of the type 1 diabetics I've seen have not been able to because they don't have the ability to produce the insulin at all. Some of the type 2 diabetics, yes. When their numbers become within an acceptable range, I have seen some of my patients not necessarily have to do the insulin, but they may still have to stay like on an oral diabetes medication. And there's more oral medicines besides metformin. There's Januvia, as I'm thinking about. There's oh,
Glipizide,
help
yeah,
me
there's
out.
so many of them. There's so many of
Yeah,
them. There's
yeah,
glimepiride and glipizide and all these other.
yes.
There's so many of
Thank you, glucotrol. I know it was like right there, and I was like, ah,
But yes, the so type 1 diabetics are typically on insulin the rest of their life because their body doesn't make the insulin. Um, But type 2, yes, I have seen some people be able to either lower their dose of how much insulin they're getting and or be able to get off of it altogether. But I mean, it takes a lot of dedication and over a long period of time.
Another question that we have is it true that there is some debate on what is considered normal? And I lost my place here. Yeah, hold on 1 second. What is considered a normal number and what's, and where that those numbers should be? I lose my question.
Uh,
Um, maybe different facilities may have, like I work for Ohio Health Riverside. So as opposed to like other facilities such as Mount Carmel or OSU, maybe they may have a different standard or range, but they're going to usually be within, I mean, points of each other. Is that what they're asking? Like when they say normal readings?
Yes.
Okay.
Hmm.
Is that
yeah,
Okay.
what
I
you
agree.
found, Daria, in your experience?
Yeah, I agree. It's typically not, I don't know if I've seen a different range for these specific numbers. Now, I know I heard about blood pressure that they were trying to push that up, that instead of the normal 120 over 80, that it was now like 130 over 80 instead, or something was normal.
Oh,
But
wow.
for blood
Okay.
sugar, I have not heard that.
Yeah, it's
That's
usually
interesting.
that's
Well, I was going to say that's another discussion. I have seen and have heard that even from my own doctors, like, oh, the new normal for blood pressure is 130. I'm like, whoa, how did it bounce up there? So I agree. Yeah, you're
right.
like, how do you move the needle like that all of a sudden, and why would you want to? So, but in some cases, I mean, there are times when some doctors say, as long as you're below 180, or as long as you're below 150. I mean, and then you're wondering, why are they telling me that when they said that this number 100 or 120 was
Right.
really more appropriate? So yeah,
Mhm.
you get mixed messages out there, and that's really dangerous and scary, and it's coming from the medical community, unfortunately. Okay, so Mike, did you have a couple questions from YouTube?
Yes. What is the difference in childhood and adult diabetes?
So, childhood, I'm assuming she's talking about type 1 diabetes. Typically, people that have type 1 diabetes do not produce any insulin. The cells, the islet cells that's on the pancreas, um, they just don't function. So you don't get any insulin at all. People with type 1 diabetes are typically insulin dependent. So you'll be on insulin for the rest of your life. Adult diabetes or type 2, you do have those have some insulin, but something has happened over time that caused it not to function as well. So we'll see a lot of those people just take medications maybe at first, but then if it's not controlled, then they may need to start taking insulin as well. Um, which I will say now, and which is why type 1 used to be called juvenile diabetes, is because now we're seeing a lot of
Yeah.
type 2 diabetes in younger kids. Because think of the things we were
Yes.
doing when we were younger compared to what they're doing now. Everybody's
Yes.
sitting in front of TV with this, the whole
Yep.
time. So, so it's different. Um, we were outside running around. We stayed out until the
Yes.
street light. Now these kids are in the house. And especially in this past year with COVID, nobody went out. Everybody's in their room
Yep.
all day, every
Yep.
day. And so we've been seeing a lot more obesity, a lot more sedentary lifestyle, even a lot of kids with high blood pressure. The stress
Yes.
level is higher. There's just so much more that we see in younger populations that we didn't see, 10, 20 years ago.
Right.
Anything else, Tara?
You hit the head you hit the nail on the head.
Well, there's a few more. One is, what would someone look for on the feet to make sure that, to avoid any type of infections and eventually amputation?
So so really good question. You want to look for, as Daria was mentioning, because of that loss of sensation in the feet, or what we call neuropathy. You want to look for like any cuts, any sores, any type of, have to be careful even when you clip your toenails.
Mm,
If they start to bleed, or if you notice them not healing as well, or sometimes if people are on blood thinners, you have to be especially careful. Look for any types of bunions that aren't healing correctly, or toenail fungus, any of those things.
great, great. Did you want to add to that, Daria? Or
No, I agree. I mean, anything that's not normal. Also, if you can't see the bottom of your feet, because a lot of people can't put their foot up to see the bottom, have somebody else look at them. So, one, every time you see your doctor should already be checking your feet. But anybody, any friend that you trust to look at your feet or that you think will want to look at your feet, ask somebody
now
to
you got a
look at the
reason.
bottom of your feet.
That's a good
Because it's
idea.
important. If you can't see it, then you don't know it's there. So, have somebody look if it's a space that you can't see.
Excellent. There's another question here in the chat, but it brings up a good question about misinformation, especially
Oh,
when it comes to processed foods. There's a lot of, here it is. Would either of you be willing to discuss the systemic complexities that have led to this rampant disease in America? It is very difficult to avoid processed foods, and there's so much misinformation about nutrition in itself. Also, certain people are less tolerant to certain types of foods, so it's very difficult.
yeah,
So,
that is
yes,
a that's a very complex question, and also very true. And in that case, I would say to seek out a registered dietitian in addition to any type of doctor and specialist. But you're right. A lot of our food is not organic. It
Mm,
has a lot of processed MSG, um, shelf stabilizer type of things, that it makes it very difficult for our diets to regulate and control. Very good question, Daria.
mhm.
yeah, that's a very complex and unfortunate situation because, for one, the healthier foods tend to be more expensive, so that's always an issue. And two, it's hard to decide. It's hard to decipher what's healthy and what's not. So my mom, she would always say, "Whatever the Lord let grow from the earth, that's what we should be eating." So, so
That's
I think
true.
about
That's
when you go
true.
to the grocery store, the stuff around the edges of the store, so the produce and then all the edge, that's where we should be shopping at. The stuff in between the aisles normally is all the processed stuff. So if we just stick with the fruits and the vegetables and the lean, meats, and then some dairy, then we're pretty good at, keeping it less processed. Um,
Right.
so yeah, and if you can hit up some farmers markets, those are always really good places to get nice organic foods. Um,
Mhm.
or Yeah, any of those. So it's hard because we've trained ourselves to eat a certain way, but
Yeah.
that way is a lot of processed, simple carb type food. So we want to change that up. It starts in the thought process of what's something good to eat, that's still going to fill us up and still be affordable, um, but also healthy.
Excellent. Well, that's a good segue into this next question, and that is you spoke earlier about some fruits are, have heavy carb and sugars, and so you shouldn't load up on the fruits. So, what would be acceptable portions for fruit, certain fruits?
Well, fruits do have a carb count associated with them as well. I don't know that I have a certain number per se of carbs that you should stay under, but look at the carb count on the fruits. I would say is a start. The higher the carb count, obviously, the more you want to avoid.
Mhm. Well, what I've been doing lately is looking at the glycemic index as well and the carb count. And so everyone has a phone. You guys can get in there and Google it. Just Google that banana, that pineapple, and it'll tell you just what the carb count is and how much sugar is in it. And then you can make a decision from there. So that's the easy
Very
way.
good.
I would agree.
Right.
We all have to do our own research, right?
Right. And also
Okay.
just to add to that, no, it's been hard, because you go to the store and you get an apple and the apples have been gigantic or the mangoes are I mean, like they're huge. So
Huge.
you don't want to pick the biggest fruit. The more fruit that you're eating, the more sugar that you're eating. So I know, bigger seems better, but not necessarily. So you want it to fit just in the palm of your hand. So just in the palm, not and you don't want your fingers to be all the way spread out to fit it in your palm. So just in the palm of your hand, and that's around about the size of fruit that you should have. That's one serving.
Perfect. Perfect. And it's all about, moderation and looking at the portion of just about everything, even your proteins, etc.
Correct.
Um, okay, so this question is hopefully motivate people to really get out there and exercise and eat right, and that is, does diabetes negatively impact intimacy and sexual activity?
Yes.
I
Yes, that is.
yes, it surely does.
Yes.
Um, Several ways actually. So first, if you're irritable and you're tired all the time because your sugar is high, then yes, you're not going to want to be bothered about having sex with your partner, with your spouse. Also, diabetes can cause you to have infections. And in women, typically we see a lot of yeast infections, vaginal yeast infections, which then hinders you wanting to be intimate with your husband as well. So, yes, diabetes definitely, can hinder your activity level and your sexual activity with your spouse.
Good,
Tara,
As
you got
good.
as
anything
I
else?
was as I was mentioning earlier on with the pre-diabetic question, the seriousness of that, that it starts working at the micro level. So it starts affecting your arteries and your veins, your circulatory system,
Mhm.
and so it can lead to low testosterone levels. It
Mm,
can lead to impotence, erectile dysfunction. So that ultimately, yes, can, and in women too, as Daria was mentioning, frequent yeast infections, all of that. So that can lower your libido and your response to wanting to be intimate with your husband or your wife. Yes.
okay, good answer. Good question there. Um, So it goes back to then again, does regular exercise help prevent diabetes?
With management, yes. Prevention is the key. We do know, of course, because of the genetic and hereditary factor, that you may be predisposed because if mom had it, grandma, grandpa had it, but your risks are lower with regular exercise and weight management. Yes.
Mhm.
And then
I look
too,
within my
along with that,
Oh, no,
I'm
go ahead,
sorry, I
Daria.
was just gonna say, along with that, I think I remember, I think it was Mrs. Troy that said it, but you can't outrun a bad diet. So you can exercise all you want, but if you're eating
Oh,
bad, it's
absolutely.
that's you gotta have both. It has to be a balance
That
of
goes without
exercise and
saying.
Amen. I like that. It's true. You got to have both. You got to eat right and you got to get out there and exercise. You
Mhm,
know, what you put in your body is extremely important. I love that line.
exactly.
That's a good one. Hmm. I was going to say that even within my own family, you know, there's four of us. And I told you about my mother and father. And my sister who is ran track and played basketball in high school, and then went on to continue her exercise regimen throughout her adult life. Um, you know, she hasn't had the same problems that I've had. So I'd say that exercising consistently and eating your whole foods and your green leafy vegetables can help prevent, at least prolong, the onset of it, even though, you know, at least in this case it did. So, all right. So let's see. What other questions do we have? Wow. Mike, do we have any more from YouTube? Well, maybe not. Okay.
Yes, we
All
do.
right. This was,
Sorry about that.
oh,
Yes, we do. Let me pull it up here. Let me see. Are certain fruits and vegetables that can help combat against diabetes? Let me pull it up.
I don't know about combat against it. Do you guys, or maybe help control?
Yes,
Some,
but it's
some, of-
mine at the
yeah.
moment. Um,
Some of the ones that we recommended early on the slide that we had about some of your broccoli, your kale, um, peppers, tomatoes.
Mm,
Some of those are
hmm.
um, good to choose.
Hmm. Good, good. Excellent. But like you said, trying to avoid the pastas that are like really high in carbs. I mean, I think what 50 plus carbs, rice and some others can be a big
Potatoes,
problem. Potatoes, especially, which is one of the reasons why
fried
I was
potatoes.
I love my potatoes. Yeah, that's why I was out there Googling. So how bad are potatoes? Like, oh, okay, I guess they are. So yes, yes, those things, you know, you don't want to avoid. But I was also reading recently that in some cultures where beans and rice is very, you know, has been eaten for generations. And the reason why there was a combination is because the rice was so high in carbs, but the beans help manage that, you know, the levels
Mhm,
of the blood sugars going in up and down. So
mhm,
yeah, some of those
and
legumes and beans.
it also depends on the kind of rice. So the rice we have here, our white rice and our brown rice, those are both really high in carbs. But if you start getting into like the long grain wild rice, then it's not as high anymore. So just,
mhm,
read the labels. It will tell you how many carbs are in each thing. And if you could stick to wild rice rather than our regular white rice or even the brown rice is really not that good.
mhm.
So yeah, just read the labels. Oh, we can't hear you.
Excellent. Sorry,
Oh,
I
there
had
it
to.
is.
My grand dog is trying to visit me here. So, all right. So I knew we were going to go over this evening. I knew it was going to happen, but because I know that everyone had a lot of questions relative to this, and I'm sure we'll come back another time and probably revisit this topic because it is something that it is a disease that's running rampant through our community, and it really left us vulnerable at the start of COVID 19, the pandemic.
Yes.
We lost so many people,
Mhm.
because of our the high blood pressure and the diabetes, etc. And then you get
Yes.
COVID, our bodies just could not handle that. So
Mhm.
I just, just really implore that everyone try to get out there, exercise, eat right, watch your carbs. Let's see, because it's starting to rage again with these new variants, and we need to be careful with our own health so that we can stay here and stay healthy. Um, Tara and Daria, some final words. I'll start with Daria.
Um, I just want people to be aware of their risks, and just to make sure that they're doing their best that they can to be as healthy as they can for as long as they can. Type 2 diabetes can be preventable. If you are exercising, and you don't even have to do anything crazy, just get out and walk for 30 minutes, 3 or 4 times a week. Go walking. And then just watch what you eat. Eat simple. You don't have to eat a lot of carbs or a lot of bread, although it's delicious and everybody always wants it. Try to scale back on some of those things because the way you treat your body now will show up later. And so you don't want to be, in your 50s and 60s and needing something cut off, or you're not able to function because your blood pressure has been ridiculous, or you have diabetes that's uncontrolled. So take care of your body, and it will take care of you.
Excellent, excellent. Tara.
I say the same thing. Now that I'm in my 50s now,
Mhm.
that it was very important for me to take care of myself and my body to be around here long enough for my grandchild and my daughters. So yes, managing our weight, our blood pressure, and the next time that hopefully if I'm asked back, I will be able to say that my numbers are down because I'm doing right and I'm walking and trying to slowly cut out my soda, my Pepsi and my Coca-Cola.
Uh-huh.
Um, so that I'm not being a hypocrite as I'm teaching my patients the important things to do, that I'm also following those things as well. And thank you once again for having me.
Oh, we'd love to have the two of you back. That would be wonderful. I do want to say, as a public service announcement, if you can stop that soda, regular or diet, you are absolutely right, Tara. Everyone should set it aside. Just let it look at something we used to do in the past. You got to let that soda go. And you'd be surprised. And I know I've seen this with some of my friends, how those blood sugar numbers just plummet just
Yeah.
making that one change. So loved having you here with us today. This was excellent, excellent information. Thank you so much for joining us. I just want to say to everyone who joined us tonight, thank you for jumping on. Hopefully you got as much great information as I felt I received. And I just want to again say that we say this all the time on the show. It always comes back to those leafy greens. Every time the leafy greens are so important. So thank you so much. Have a wonderful night and stay safe and stay healthy. Have a good night, everyone.
Good night. Thank you.
Good night. Thank you.